a baby comes to see me in the office and there's some concern about tongue tie or feeding problems. Um, how do I decide if we need to do something or not? It really depends on a couple of variables. So fundamentally, yeah, it depends on the anatomy. How short are things? What does it look like? So when we're looking at that little frenulum under the tongue, how far forward or back it is, how tall or short. The anatomy is something that we always look at. But it's not the only variable when we're trying to decide, do we do something? Is it the cause of the child's feeding problem? The other issue really is, what's the function? How are we doing? So if I see a kid with a slightly short or tight frenulum, but they're having zero problems feeding, everything's going well, there's no pain, there's gaining weight well, then even if it looks short, we may not jump in and do anything. On the flip side, if a baby is really struggling, mom's having a difficult time, having a lot of pain, the baby's not gaining weight, even if the frenulum doesn't look that bad, we may consider doing a procedure just to really make things as efficient or as good as it can be. So really it boils down to not just what the anatomy's like, but how are mom and baby doing. So clipping a frenulum is really easy to do. It really involves just a cutting instrument to release that little flap under the tongue. In general, it takes about 5 or 10 seconds to do. It's a little owie and it's over. Kind of like biting your cheek, there's a little bit of discomfort with it. If you chomp hard enough, there may be a couple of drops of blood, but it doesn't keep gushing. There's nothing in there that's going to cause any profuse bleeding. And the babies get over it within a few seconds and can feed immediately afterwards. Clipping the frenulum results in a small little raw area under the tongue. It's a little sore spot, just like if you bite your cheek. There's going to be a little bit of sensitivity there. There's really no modification of the diet. As far as management or aftercare, there really isn't anything. You bite your cheek, you don't get stitches, you don't take antibiotics, you don't take pain medicines. It's really something where you do and then you forget about it. You can pretend like nothing happened.